Congestion, runny nose, sinus infections. It can be hard to tell the difference between allergies and sinus problems. That's why we have Dr. Neil Jain. He is here to help. How are you?
Hi there, how are you today?
I'm doing well, thanks. As I understand it, there was a new survey about nasal congestion symptoms. What are some of the top findings?
Yeah, so we partnered with a company called Optinose to do this survey, and what we found is that nearly 25% of those that responded reported having chronic nasal congestion with symptoms occurring almost daily. And 85% of those nasal congestion sufferers said it impacts their daily life, including 60% who said it impacts their sleep. That's significant because we know that when we have problems with sleep, it can cause all kinds of other health problems, and sleep is fundamentally important to our general health. Almost half of those that said they had congestion said it impacts their ability to taste and smell food. And this can be a sign of a deeper problem, something called nasal polyps. Most people know about allergies as a cause, but they don't know about these other causes. And less than half of the people who have these chronic nasal congestion symptoms report seeing a specialist, such as an ear, nose, and throat physician or an allergist, to try and figure out what the cause is. So, if we see someone that's having symptoms lasting more than 12 weeks, more than a few months, they really should see a specialist so we can figure out what's going on.
That makes sense. So, what are the common nasal polyps and what are some of the symptoms?
These are growths of inflammatory tissue. They're not cancerous. They develop high and deep intranasal passages. They are often the result of things like allergies or chronic inflammation that can result from pollution in genetically susceptible individuals. And ultimately, if we find them, we try to treat them. The first line therapy is still nasal steroids, which are over the counter. There's also surgical intervention, the problem being that these polyps can come back because they're growths of inflammatory tissue. There is another treatment known as Exhance, which is a nasal spray that uses our breath. We blow into it, and the difference is that it allows us to spray the medication high and deep into the nasal passages, which can help to shrink those polyps over time if it's used appropriately. As with any medication, there are common adverse effects, which include nosebleeds, nasal ulcers, septal perforation, glaucoma, cataracts, impaired healing, or increased risk for infection. And so these are things that we look out for, we screen for, and we're aware of, and it should be really used under the care and direction of a healthcare professional. There is a website, www.treatnasalpolyps.com, which can provide information about this condition, as well as a questionnaire that people can fill out. They can carry it to their healthcare provider and have a discussion about what might be causing their symptoms. And that may then lead to a referral to a specialist to help us identify this problem.
Interesting. All right, Dr. Neil Jain, thank you so much for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.